Hi, I'm Samira. I am the QI person and I will be playing the role of the patients.
I'm Dwayne, and I am the radiology tech.
Alana, and I'm the doctor.
Jill, and I'm the nurse.
Deirdre, I am the radiologist. Well, that was an interesting meeting.
Agreed.
I agree.
Mhm.
I'm glad to hear that it was useful.
Can you believe it's been a year since the incident?
I know. I remember the patient, Mr. Smith. He was in a car accident, he had a chest injury and some difficulty breathing. I should have done a more thorough assessment.
Well, we all have ownership in it. I didn't get my assessments documented quickly.
I might not have looked at it anyway.
Well, I can't believe I mixed up the left and right. I must have been tired or something. How could I mess up anatomical left and right after so many years on the job?
You mixed up left and right. Tell me about it. I should have seen that the heart was on the right side of the chest anyway.
And
I really failed that patient. Sometimes I get so hyper focused on one obvious problem that I look past all the smaller ones, especially when I have a lot of x-rays to review each day. I don't even want to mention how quickly I sometimes review those x-rays.
oh no.
Well, thanks to all of you and the other members of the committee, we have been able to address some areas that needed change.
Yes, and I am very glad that we've changed the radiology order process. I know what symptoms the providers find troubling, and when I do that, it helps me focus on that area in the X-ray. In this case, knowing the symptoms that were found on the left side, but seeing a pneumothorax on the right would have probably made me stop and double check my results for that patient. I would definitely have noticed the mislabeling, especially for a chest X-ray. Again, where the heart really can't be on the right side.
I was really skeptical about having two technicians check the labeling and double check the order against the image for errors. I thought it would take too much time, but it's working out well. And when I work with someone doing different imaging, like MRI tech, I get some review of that when I had to cover for her. So it's really helping me do a better job, and I keep broad skills.
I'm glad that the hospital has agreed to the nurse-led enhanced timeout protocol. I know that was really a big leap of faith for the physicians.
Yeah, I was skeptical, but when you explained that the core of your practice as a nurse is patient safety, I had to step back and realize that this isn't how I'd describe my practice. Of course, do no harm, but I wouldn't describe my practice that way. I'm glad we're giving it a try. Either way, we must do timeouts for all invasive procedures, no exceptions.
I've got to admit, I didn't even know that the hospital had a policy on universal protocol for all invasive procedures everywhere.
Well, I'm admitting it too. I did not know.
Yeah,
No.
yeah.
The new employee education is working out great. The newer staff in the ED and critical care units were nearly all aware of the need for it and for other safety checks. And we are really done with the training for existing employees. This should make a difference.
Yeah, and I'm glad that the doctors and the nurses will be checking the radiology reports that we're sending back. An extra check by someone who's seen the patient is definitely a good policy.
I agree. Safety first. This organization is even starting to just kind of feel overall a little different. I'm so glad that management are allowing some of these, encouraging some of these safety initiatives and making leadership and nurse leadership a priority. I'm really looking forward to working, Samira, with more QI initiatives.
Absolutely. I'm noticing that change and the better improvement too.
Excellent. So how about we go to the sim lab and act out this scenario and do right by Mr. Smith this time. I'll play the patient. We can act it out a few times with various team members, making an error to see how all our safety checks work out. I know who makes an error on round one, but I am not telling you. Okay.
All right.
All right,
Let's go.
Hi, Mr. Smith. So, what happened? I understand that you had a car wreck. How are you feeling?
Too good. I can't breathe.
Oh, okay. Well, listen. Let me take a quick listen. All right. Just gonna check your ID again, Mr. Smith. Give me a listen. Just breathe. Maybe want to lean forward just a little. the doctor's gonna come right in and see you.
Okay.
Okay. All right, Mr. Smith, the doctor's gonna be right in.
Hi, Mr. Smith. I'm the doctor. My name is Alana. I see you're having a hard time breathing. I'm gonna take a listen, okay? Not hearing any lung sounds with left lower lobe. All right. I'm gonna order a chest X-ray right away, okay? I believe you have a left pneumothorax.
Good. What we got here?
Mr. Smith X-ray. What do you think, Doc?
Mr. Smith's X-ray. This
Yeah.
looks like right and left. Looks like a right-sided pneumothorax right there on that side. See? Let's see what the paperwork says.
Yes.
Oh.
Ooh,
Physician says he is absent left lower lobe. Let's take a
this is the left.
Oh, look at that. This is the wrong. It's switched. This isn't labeled the right way. This patient needs another X-ray. We gotta go do another one.
Okay.
Let's
Let's
go
go do
get-
that.
Let's go get another one.
All right.
That's not right.
So, Doc.
All right. This is the redone one.
Yeah, man. Hey.
That's correct now.
Trust
Now we've
me.
got to correct that.
They're lucky they have you, alright?
Yeah.
Trust me.
All right.
OMG.
All right. So this is definitely. Doctor was right. It's definitely a lower left pneumothorax. Let's type up that report and send it right back to
Okay.
them. That's
All
on
right.
the left side.
Okay.
So it looks here like you have a collapsed lung on your left side. So what we're gonna have to do is insert a chest tube, and it's gonna hurt, but you'll be relieved quickly after as soon as we remove the air from your chest that is preventing your lung from expanding, okay? So the nurse is gonna come in to assist me with that.
All right, doctor, here's the kit.
Thank you.
Right. So, we're gonna stop the timeout. Can you give your full name and date of birth, please?
Mr. Smith, February 15, 1999.
Okay.
Let me just
And doctor, can you please confirm the patient?
confirm this is Mr. Smith, date
Okay.
of birth, February 18th, 1999.
Okay, good. And what is the procedure?
We're inserting a thoracostomy tube on the left chest.
Okay, so confirm that we're doing a thoracostomy tube and you're confirming the side.
Yep, I'm
Is
gonna
on the
just
left, you're gonna,
mark you here. So we
Okay.
confirmed the side.
okay. Now, the key nursing assessment is that the patient presents with dyspnea and absent lower left lobe sounds. Do you have any concerns about performing this left-sided thoracostomy?
No concerns.
Okay, no concerns. So let's get going here then.
Okay.
So
No,
I'll open up the sterile kit for you.
Great.
Right. Okay.
And take a deep breath out.
Okay. You feeling any better, Mr. Smith?
Oh, much better.